Hello, Instagram. Thank you so much for joining me here live. Happy New Year. It is January 1st, 2025. And one of my New Year's resolutions is to do more lives, which is actually really outside of my comfort zone because it's kind of intimidating, right? To just sit here in front of a screen and talk. So anyway, I wanted to share some of my knowledge with you guys, and my New Year's resolution is to do an Instagram live weekly on Wednesdays. I want to call this Clearing the Air, where I will answer some of the most commonly Googled questions. See, look, for those of you that know me, I'm such a planner. I never come on here without preparation, but I actually Googled what were the top 20 most Googled questions regarding medical spas, medical spa treatments, medical grade skincare, and pre and post treatment care. Also, if you guys have any questions, feel free to type it in the chat and I will try my best to answer these questions and yours. But I would just, let me go ahead and get started, I guess. Alrighty, so here are the 20 most Googled questions related to medical spas, medical aesthetics, and medical grade skincare. Number 1, what is the difference between a day spa and a med spa? So there's one big difference. When a spa is called a med spa, it is that they have medical grade procedures and products. So they need to have a medical director, and typically providers such as physicians, physician assistants, nurse practitioners, licensed medical estheticians are running these medical spas, and services are cleared by the FDA. And they're more corrective than a medical based. So when I say medical, also like for an example, skincare, like facials or skincare ingredients, they're just more potent and they're made in a way that your skin just gets more correction, So day spas, I'm not trying to bash day spas, and actually this is a chapter in my book, by the way. But day spas, it is nice for relaxation, other types of aesthetic services like doing your lashes and brows, you'll see that a lot. But when it comes to skincare, I don't like to mess around. I like the medical grade. I'm an all or nothing girl, so more corrective the better. But yeah, most commonly asked question number 2. What treatments do med spas offer? So medical spas, the most common treatments are going to be injectables, right? So it's going to be Botox, filler, PDO threads, biostimulators like Sculptra and Radius. A lot of med spas offer laser treatments like laser resurfacing, tattoo removal, laser hair removal, skincare services such as microneedling, chemical peels. And let me backtrack too. Microneedling at a medical spa is again with an FDA cleared device where the needles are penetrating the skin just deep enough to stimulate collagen. Other places that are offering non-medical grade microneedling, maybe the needles aren't penetrating as deep. But what other services? Gosh, there's just so many. And then there's all the hormone replacement therapies. A lot of med spas are offering that. Just a ton. I don't know. I don't want to ramble. Gosh, that needs to be my New Year's resolution number 2, not to ramble, right, on these lives. Sorry, while I work out the kinks. This is my first live in a long time. Okay, so number 3, are medical spa treatments safe? Ooh, I actually just filmed a reel on this. So when you are seeing a licensed medical professional that is specialized in the field of medical aesthetics, then yes, medical treatments are safe. However, with any treatment that you do, cosmetic or not, there are risks in it. So as a provider, I always like to outweigh the risk with the benefit to make sure the treatment that I'm offering my client is going to be safe, effective, that there's the client has realistic expectations. But yes, when done by a professional, it is definitely safe. Again, medical spas offer FDA cleared or FDA approved services and products. So all of these products and services have been tested and deemed to be safe, as long as you follow the protocols, of course. Alrighty, do you guys have any questions? I mean, I know Google says these are the top 20 questions, but if you guys have questions, I mean, I definitely will answer any of those. Alright, so how much does a med spa consultation cost? You know, let's be honest, every provider is going to be like, oh, we offer free consultations, as if like you're like winning something. Everyone has free consultations. The value, I do put a value on my consultations because my time is valuable. I book out plenty in advance, and that time slot is dedicated for the individual. So typically my consultations are $125, I think it's $125. But I as of right now, they're still complimentary. At some point, maybe we start charging. I don't know. Usually they're free. I would not try to DM your provider and try to get a free consultation via DMs, because it is just best to go in person, them to see you, talk to you, get to know. You want to build trust and a rapport, right? Not just me with the client, but the client with the provider. I mean, you're trusting them with your medical services. So definitely worth going in and getting that complimentary consultation. All right, I'm so excited. My first question: if you would recommend one treatment everyone should get, what would you recommend? I'm gonna have to say Botox. Everyone needs Botox. Botox is a preventative. It's going to prevent wrinkles from forming once these fine lines are etched into the skin from repetitive motion of your muscles in your face. It's just so hard to reverse, and I can't tell you how many times I have women in their like mid to late 60s come in and see me, and they're like, okay, I want Botox to erase all my wrinkles. It doesn't really work like that. So Botox, you want to start in your mid to late 20s. I mean, you could start earlier, but there's also a ton of other benefits to Botox, right? It lifts the face, so you get like a nice brow lift, could lift the pink of your lips. We're seeing Botox lift the jawline, for the neck. There's also medical therapeutic benefits too, like for migraines, for excessive sweating in the underarms. So, yeah, Botox for everyone. Great question. All right, let me go back to my list. Number 5, what is the recovery time for med spa procedures? So this is going to vary on which procedure you get. When you go to like a plastic surgery office or dermatology office, they offer maybe procedures with, I shouldn't even generalize like that. There's some procedures in some offices where they're going to have where you have a little bit more downtime. In my practice, I've found that people don't want pain and they don't want downtime. Like, we all live busy lives and we don't want to look like a wreck. I actually, you know what, side note, I did microneedling on myself 2 nights ago, and the reason why I chose the microneedling device that we have, Skin Pen, is because not only does it give you great results, but the downtime is so minimal. I put on some makeup, and yeah, I did cause a little bit of bruising on a scar I have here and here. But you wear makeup and then you can go out and about 2 days later. So with my services, there's maybe possibly the risk of a little bit of social downtime. So if you bruise or you have swelling, that could last about a week. But as far as like blisters or open sores or like the top layer of your skin being burned off or anything like that, honestly, I don't offer any of that. It's just going to be like the bruising and swelling downtime. The technology is getting so good too, where there's a lot of procedures where you don't even have any downtime, like and that would be the goal, you know, as long as you get the results and no downtime and no pain. Alrighty. Okay, so number 6, aesthetic treatments. What is an injectable Brazilian butt lift and how does it work? Okay, I love how this question is being asked. If you follow me closely in my stories, you're going to know that I actually did get an injectable Brazilian butt lift recently. It was my Christmas gift. So I had Sculptra injected in my butt, and Sculptra stimulates your own collagen production. So it's going to help with volume enhancement. It's also, the collagen is going to tighten the skin. And I mean, I don't care if my butt is glowing, but when you inject your face, you have a nice, beautiful glow to your face. So, collagen stimulation and filling in the volume. And you want to inject in a way where, like, when you had a pancake butt, now you want to inject at the top to give you a little bit more curvature and lift. And that's what I had done. I'm actually posting a reel on it. I'm going to post my before and afters. I've been talking about it a lot, but Sculptra for the injectable BBL is amazing. Very little to no risk, besides bruising and bleeding, but like, the surgery, I mean, I've never had a BBL surgery, but from what I've heard, the surgery is very painful and a lot of downtime. So it's a great alternative for someone that doesn't want to do the surgery. Do you guys have any other questions? I mean, if you have questions, please let me know. I'm just going to go through my Google list questions because I don't know what else to talk about. So, alrighty, number 7. Does laser hair removal hurt, and is it suitable for all skin types? So we actually offer laser hair removal at Aire Med Spa. We use the Soprano Ice machine, which is a laser hair removal device. It is virtually painless. I'm going to say virtually painless because I make a joke to all my clients, on your upper lip and on your lower lip. So on the upper lip and the labias, for women who are doing the full Brazilian, you will feel the laser a little bit, but anywhere else, it feels like a hot stone massage. It actually feels kind of good. And yes, it is safe for all skin types, safe to do all year round, even on tan skin. I think it's the best laser hair removal device out on the market. And honestly, I am so impressed with how quick the treatments are. We can treat half your body in 30 minutes and then your full body in like 60 minutes or less, which is amazing because most people want like their full body done. You know, they don't want to just do their upper lip and that's that. I don't know. I mean, I didn't. I basically have the hair removal like up from face down. Totally worth it, by the way. Alrighty. What are PDO threads and how long do they last? Okay, so if you guys, again, if you follow me for a while, you'll know that I'm a PDO thread specialist. I love the PDO threads because it gives an instant lift to the skin. I can't tell you how many women come in here and they tell me like, I want to look like this again. I like pull my skin up and back, but without plastic surgery. So the best way to actually lift sagging skin is going to be with PDO threads. PDO threads are sutures, like when you go to the ER and you get a cut and then they like give you stitches to sew it up. So it's basically that material. PDO stands for polydioxanone. And that material is made like with like little, they're called barred threads because there's like little hooks all through it. And I make like one little insertion right back in the back hairline area, and I place the threads down underneath, like kind of like one long line all the way down to like grab this area here, and the hooks literally just hook and pull back. The threads, they dissolve and they absorb in the skin, and natural collagen is stimulated after the threads are absorbed. Oh, what areas on the body can you do thread lifts? Yes. So let me finish my thought. So threads pull and lift the skin instantly. Threads are absorbed. Natural collagen is stimulated. So the threads last about a year. I've been saying this to a lot of my clients too, that the more you do threads, the more you maintain, like the better, kind of like Botox and filler. Like it's not like a one and done treatment. Like, yeah, you'll see instant results, but the more you do it, the better the results get over time because you're also maintaining. So you can do threads virtually anywhere on the body. I do a lot of smoothing threads for the body. So I've done, smoothing threads are different than the lifting threads. Smoothing threads tighten the skin and stimulate collagen and help get rid of like the crepiness or help like lift sagging skin. But I'll do it on the neck, on the arms, You could do it in the chest area. The stomach is very popular for my women who had babies and they have sagging skin. And I've done the knees too. So basically anywhere where you have sagging excess skin, I do smoothing threads, occasionally the lifting threads, but mostly the smoothing threads for the body. Alrighty. Next question. Is RF microneedling better than traditional microneedling? Okay, so RF microneedling, RF stands for radio frequency, where you're using radio frequency wavelengths and heat to also tighten the skin, stimulate collagen. It's a little more enhancement than regular traditional microneedling, where you just use the needles to penetrate the skin and stimulate collagen. My personal opinion, I've never tried RF microneedling, but from what I've heard, it's painful and there's a little bit of downtime. Like how I mentioned earlier in this live, at Aire Med Spa, our goal is to provide the best experience. So we're trying to offer treatments that have very little to no discomfort and very little to no downtime, because I find that people are just busy and they don't like to go to a spa to get hurt. So, yes, in theory, and when done properly and when it's the right client, I think RF microneedling can offer an enhanced and more corrective result. From what I've seen, I think traditional microneedling is just as good. How we enhance our traditional microneedling treatments is that we use skin boosters with it. That's really actually the secret sauce. The skin booster enhances by stimulating even more collagen for even months after the treatment, enhancing hydration, enhancing glow. Like I said, I just did my own traditional microneedling treatment at home 2 nights ago, and you see, like, I have no open sores. My skin's actually really glowing and smooth. I'm so happy with my results. I feel like it's just consistency. If you do consistent traditional microneedling, which is way less invasive, way less risk, by the way, because there's more risk with RF microneedling, I think you can get just as good, if not better, results. So, alrighty. Hopefully there's no more controversial questions on here. And if you guys have questions, please let me know, because I'm happy. That's what these Instagram lives are for. I'm clearing the air and answering your most commonly asked questions. All right. What is the best treatment for hyperpigmentation? Oh, this is going to be one of my favorites. The IPL is excellent for hyperpigmentation. Now we want to make sure we differentiate hyperpigmentation and melasma, because they're two different things. But I'm just going to, for time purposes and the question purposes, I'm just going to focus on hyperpigmentation, because that's what most people have anyway. So that's pigment directly related to age and direct sun exposure. And they're like brown spots, age spots, sunspots, however you want to call them. But how IPL, intense pulse light, works is it's a light machine that targets those dark melanocyte cells, destroys them, and they resurface to the skin and flake off. It's important to have realistic expectations. If you're pigment prone, a lot of the pigment is heat related, and come on, living here in Florida where there's a lot of heat, it's just important to be realistic. And these treatments, again, the more consistent you are, as long as you're using the at-home skincare every single day and night, you can reverse the hyperpigmentation drastically, but I don't know if there's ever 100% reversal. But IPL is a great start, and at-home skincare and sunscreen, no matter what. Oh, yes, there's another question. Okay. If you could only pick 2 skincare treatments to use daily to look younger, what would you recommend to us to use? Oh, okay. You know what? I actually, I'm going to have a special direct link. I got to make sure it's up, by the way, that my IT guy put this on our website. But I do have an Aire Essential skincare kit, a skincare bundle that I want to offer to you guys. But I did choose 2 skincare treatments. I don't care if you are 16 to 96. I don't care what color your skin is, what your concerns are with your skin. You need these two products. You need to protect your skin, and you need to prevent future damage from happening. So kind of like what I was just saying, sunscreen no matter what, every single day, especially if you live here in Florida. Honestly, every single day, no matter where you live, because on Instagram, I probably have followers that live other places. So sunscreen no matter what, preferably mineral-based sunscreen. And then you want to correct some of the damage too. So correction with a retinoid or retinol or tretinoin. But honestly, I prefer the retinoids because they're a little more gentle on your skin. Huge Skin Better fan. As you can see, those are my Skin Better products. But Alpha Red overnight cream every single night before you go to bed. That's going to help reverse some of the damage that has been done. It's going to help smooth fine lines. It's going to help with texture, pigmentation, dull skin. So you need one product for prevention, sunscreen, and one product to help correct, which is a retinoid. Everyone needs it, no matter what. Alrighty, so let's go to the next question. That was a very good question, by the way. And if my bundle is up on my website, I will put a direct link on there. Medical grade skincare. Ooh, this is a nice segue to the medical grade skincare. What is the difference between medical grade skincare and over-the-counter products? This is a great question because all the time I have people tell me, "Oh, I already have a moisturizer. I already have sunscreen." Yes, over-the-counter products are great, and I'm glad that you have a routine, and I'm glad that you're using something. But just because the back label on the skincare products says it has certain ingredients doesn't mean it's made in a proper way where your skin's gonna absorb it very well. And it doesn't mean that it's a very high percentage. So with medical grade products, it's all FDA cleared and approved. Also, it's been studied to be effective. So it's, prepared in a way that your skin's gonna better absorb it and not just like sitting on the top layer of your skin. What use is that, right? What correction are you gonna see if you're just like putting on a moisturizer and it just doesn't even penetrate the top barrier of your skin? And then also the ingredients. It's a higher ingredient, higher potency, and you're just gonna see that much better result. I mean, one medical grade skincare product could give you like the same result as like 10 over the counter. And like a lot of people justify, well, the price of this, well, this is cheaper, well, this is all I can afford. But like, are you really saving money when you're spending a lot of money on all these different products that don't even really work? You don't even really see a difference. With medical grade, you are going to see a difference, and it's an investment in your skin, and it's going to be totally worth it. I think I do the breakdown too on some of my posts that's going to be coming up soon. But honestly, it's like $1 or $2 a day to have flawless skin. Like, these products are definitely doable and should be prioritized if you care about your skin. Alrighty. Number 12. When should I start using retinoids? Oh, I think I'm supposed to say 18 years old, to be honest, because that's when these, in the studies, these products are tested on 18-year-olds, 18 and older. Oh gosh, this new generation, the Gen Zs, they are on it. Like, I don't have a TikTok account, but I hear about all these TikToks about skincare and a lot of girls starting younger, and that's like the cool thing to do. Honestly, I would wait for the retinoids until 18, because what kind of damage do you have onto your skin at 18? But an actual skincare routine, the younger the better. Yeah, put on that sunscreen, use that moisturizer, do a face mask. It's fun, and it gets you in the habit, and it gets you to start caring about your skin, which is so important. Alrighty, why is sunscreen important, and which one should I use? So I kind of mentioned this earlier. Sunscreen is so important because you're constantly being exposed to harmful sun rays from the sun. And I know I'm talking a lot about like aesthetic things like wrinkles and dark spots. But think about it. There is a direct correlation with prolonged sun exposure on your skin and skin cancer. So I know it doesn't really bother you now, but in the future when you have huge basal cell carcinomas on your face and then you have to get a Mohs procedure to get them cut out, and then now you have even bigger scars on your face, like it's just it you know, I actually read a post the other day. It was by an influencer that I love and follow closely, Savannah Boda. She had mentioned that skincare is health, it's medical care. The skin is actually the largest organ in the body, and you have to take care of your skin just like how we take care of your heart and your overall health and your gut. Like, so yeah, using sunscreen, preventing skin cancer and preventing the aesthetic things we don't want. And then also you want to use a mineral-based sunscreen, not a chemical-based. A mineral-based sunscreen is going to better absorb in your skin and usually gives protection against UVA, UVB, sun rays, and not cause inflammation of the skin. Whereas chemical-based sunscreen, so these are going to be a lot of the over-the-counter sunscreens, like, I don't know, I don't even want to name names, but just make sure what you're getting is medical grade, because the chemical sunscreen actually, it absorbs the sun rays even more and absorbs heat more. And I talked a little bit about this, that heat does cause a lot of inflammation and damage to the skin in the long run. So yeah, it's nice that you're wearing sunscreen, better that than nothing, but make sure it's mineral-based. I personally use sunscreen every single day. I like efficiency. So I prefer a sunscreen that's like a 2-in-1. So I use a tinted sunscreen, so it gives me a little bit of a tint, so it serves as like my foundation, and it's 75 SPF. Again, the Skin Better line. Or I used to use another sunscreen that was a moisturizer or a tinted moisturizer. So if like you can have one that's mixed like that, the better. Just making sure it's mineral. Alrighty, let me know if you guys have any more questions. I'm almost done. I'm at 14, but if you guys have any questions in regards to medical aesthetics in general, I'm here to answer any of it. I am giving you the top 20 most Googled questions in regards to medical aesthetics and answering them. Number 14, can I use vitamin C serums daily? Yes, vitamin C is actually one of the non-negotiables to your skin. Vitamin C is going to help brighten your skin, prevent dullness, and it's also, oh, someone sent a request to be in live. I don't know this person though, like, just type in your question, actually. Type in your question and then I'll answer your question. Alrighty, but vitamin C is going to help brighten your skin, protect your skin, and it's also going to prevent inflammation, which is so important. It's one of the non-negotiable must-haves. Someone hearted. Okay, number 15, what are the risks of buying skincare products online? So I feel like if you buy a skincare product from a reputable online store, that's totally fine. But if you're going to go on Amazon, you just don't know where it's coming from. I personally would rather buy direct from the manufacturer or direct from your provider. I mean, not only are you supporting them, hello, I would love all the support I can get. But also you just know that you're getting good quality, because some people are just unethical and you could get expired product, you could get product that was already open. It's just, I wouldn't risk it. These products aren't cheap, and if it's like too good to be true, often it is. Number 16, let me know if you guys have any questions, by the way. How far in advance should I schedule a facial before an event? At Aire Med Spa, we offer the Diamond Glow Facial. What I love about this facial is that it deep cleans, exfoliates, and infuses the skin with medical grade serum. It is a medical based facial, so clinical, you're going to see corrective results the more consistent you are and the more regular you are with your treatments, and you're going to see beautiful, flawless skin for weeks after your facial even. We do a lot of facials the day before main events. Like, we'll do a lot of like brides, mother of the grooms, and honestly, like the day before or the week before, that way your skin is clean, brighter, smoother. Often our esthetician will dermaplane, if you're into that, where they kind of like scrape off all the peach fuzz off your face so that way your makeup applies better. But definitely, yeah, day before, that's what I would do. Alrighty, number 17, how long does it take for fillers to settle? So with fillers, it's an injectable. I tell my clients about a week to 2 weeks, only because sometimes there's swelling, sometimes there's bruising. You could feel lumps and bumps, and that could just be underlying hematomas, which is bruising underneath the skin. So I give it about a week to 2 weeks for it to settle. And then if you have any questions, concerns, go back to your injector, have them take a look. But usually after that point, you're pretty good to go. You do see results right away, but for the whole look to settle in, about a couple weeks. Number 18, how often should I get a Diamond Glow facial? Once a month is recommended. Yeah, once a month. And number 19, what can I do to prevent bruising after injections? Arnica supplements, so Arnica tablets and Arnica gel is super beneficial. Arnica is just an over-the-counter herbal supplement that you take, and we actually carry it here too. That helps accelerate the healing process. A lot of my clients actually, I recommend, and they've been doing this too, which I notice a huge difference, is that if you take the Arnica supplements 3 days before the procedure and then continue to take until after all bruising is resolved. I've had women do like their full face threads and not a single bruise because they started with the Arnica prior. So Arnica is super important. Also, kind of like a fun fact about IPL, the Intense Pulse Light machine, the machine I told you about that helps treat dark spots, that actually can help heal bruises faster. So like in a pinch, when someone's like, oh my gosh, like I have a huge event and I got a bruise, like now what? We could always bring them back in the office and do IPL. I don't recommend it because it's like not 100% guaranteed, but the IPL will help shrink that blood, you know, the hematoma, the blood underneath the skin, and minimize it. Honestly, I've done it to myself, and I've had massive bruising. Like I bumped my knee on the procedure chair or something, and honestly, it cleared in less than 3 days. So I was really impressed by that, but I wouldn't bank on the IPL. It's best to plan these things out and plan 2 weeks ahead. So if you have a big event that you're preparing for, plan 2 weeks prior to get your injectables. All right, last question, unless you guys have any other questions for me. I'm so excited. Hopefully I didn't ramble too much, and hopefully this was informative too. I'm going to save this and repost it on my YouTube page at Dr. Walters DNP so that you can watch it again. But yeah, next week's episode, I'm going to condense a little bit more because I do feel like I rambled a little bit. Ooh, I have another question on here. All right, let me do this question and then I'll do mine, and then that'll be it for the live today. How often should I plan to see my provider for Botox and fillers to maintain? So maintenance is the key to best results. For best Botox results, I recommend once every 3 months, and we actually encourage our clients to pre-schedule their appointment before they leave. It's just like how when you go to the dentist. I know you don't know what you're going to do a year from now, or when you go see your OBGYN. I know you don't know what your plans are, but it's good to put something in the books. That way you're consistent and you remember, hey, now is about the time. And yeah, once every 3 months. And then for filler, it's going to vary. I tell my clients once a year, maybe twice a year. And how we keep track of this is with the Botox. So if you're doing Botox every 3 months, about every other visit, I'll maybe extend the appointment time and to allow time for some fillers. Alrighty, last question. Can I work out after a Botox or filler treatment? No, it is not recommended to work out. If you love to work out like me, make sure you plan your workout for the morning and then you plan your Botox or filler appointment in the afternoon. Why? Botox, we're strategically injecting in muscles of the face. And when you work out and your blood pressure is high and you're going upside down and you're sweating, you could actually spread the Botox into other muscles that were not intended to be relaxed. I've seen this happen before where I had an eyelid ptosis, not a brow ptosis, but the eyelid started to droop because I injected around the eye. This woman went to the gym right afterward, Botox spread, and then she had this droop, and honestly there's no reversal for Botox, unfortunately, so she kind of had to wait a couple months before that resolved. But to minimize your risk, we want to avoid working out afterward. You also don't want to overly massage your face or get a facial afterward, and you don't want to like lay directly on your face for about 4 hours after Botox. Filler, could you go to the gym after filler? Yeah, you probably wouldn't mess it up. I still don't recommend it because when you're working out, it's just heat induced and you're going to be swollen from the filler. So it's going to add even more swelling and potentially prolong that social downtime of bruising and swelling. So I just skip a day or do it in the morning. Well, everyone, I am so excited that I followed through with my New Year's resolution and did an Instagram Live. Again, I plan on doing these once a week, Wednesday afternoons. I want to go through the most commonly Googled medical aesthetic questions so that I could help provide more information to you and for you to come on here. We could get to know each other. You can ask me questions that you've had, or if you want to DM me with any questions, I would be happy to talk about that too in my Instagram Live. I call this Clearing the Air by Dr. Walters. Anyway, thank you so much, and Aire Med Spa, the place you go to look and feel like a millionaire. See you next week.